Hello, everyone. Just wanted to call this meeting of Health and Human Services to order. Today, we will have two agency reports, one from the Department of Human Services, Social Services, and then also the Executive Department of Boards, Commissions, and Offices. At this time, I just wanted to acknowledge our phenomenal analyst, Samuel M. Quist, and we will be looking at the analyst report for DHS Social Services.
All right, thank you, Senator McCray and members of the subcommittee. Share the presentation up on the screen here. Just 1 second while I pull this up. Okay, sorry for the delay. The analysis document should now be shown on the screen. This is the budget for the Department of Human Services, Social Services Administration. As shown on the first page, the budget for DHS SSA is $690.8 million in FY24, which is a total decrease of about $13.2 million or 1.9% from the fiscal 2023 working appropriation. This decrease is primarily driven by changes in federal funds, as well as the largest area in the foster care maintenance payments program, which decreases by approximately $18.4 million, which we will go into further detail in the analysis. I'd like to begin by discussing exhibit number 1 on page number 5 of the document. These are reporting a couple of child safety performance measures that the department provides a reporting on. The first is the number of children with no recurrence of maltreatment in foster care. DHS has a goal of achieving at least 90.9% of children not experiencing maltreatment recurrence after 12 months of a first occurrence. As you can see in exhibit number 1, DHS has met this goal for the past 3 fiscal years. However, in fiscal 2022, there was a decline of about 5 percentage points. This is consistent with some of the slight increases in maltreatment reporting that we've seen over the past fiscal year coming out of the pandemic period. And then the other performance measure shown on this chart is the rate of victimization in foster care. This was at 10 per 1,000 days of foster care in FY22, which was also a slight decrease from fiscal 2021. And in the analysis, DLS is asking DHS to comment on steps that it is taking to reduce the rate of victimization for children and youth in foster care. Exhibit number 2 on the next page, this is showing another performance measure related to foster care. This is the rate of placement moves. DHS has a goal of limiting the number of moves to no more than 4.12 per 1,000 days of foster care, which equates to a move approximately every 243 days. There's been some impact on this during the pandemic. Earlier on in the pandemic, there was more impact due to quarantine-related needs and other factors impacting the stability of placements. And as you can see in exhibit number 2, the rate of placement moves has increased the last couple of fiscal years to about 6.65 in fiscal 22, which is the equivalent of a move every 150 days. So DLS is also asking the department to comment on efforts that DHS is taking to minimize placement moves for children in foster care. And then the third performance measure exhibit that the analysis includes is exhibit number 3, which is showing adult protective services through the adult services division of SSA. And as you can see on here, the blue line on the top is showing the number of reporting of adult abuse to the department, which has increased for the second consecutive fiscal year. Similarly to child protective services, adult protective services reporting was also impacted during the pandemic. So you're seeing in the past couple of years, the reporting has been trending upward. As far as the number of indicated or confirmed cases of adult abuse, these have also increased above pre-pandemic levels following a decline in fiscal 2021. Turning to the budget discussion, the first item on pages 7 and 8 is a discussion of the fiscal 2023 deficiency appropriations that are included in the budget bill. The first deficiency appropriation is $8.2 million in general funds for the Montgomery County block grant. And this is due to an adjustment being made to the fund split for that, increasing the proportion of general funds relative to federal funds. Under state law, Montgomery County receives a block grant for its share of child welfare, adult services, family investment, and other administrative expenses, other than operating similar to a local Department of Social Services in other jurisdictions. By law, Montgomery County has its own more or less separate structure, allowing it to provide additional flexibility in operations. The other deficiency appropriation included in the budget is $11.5 million in federal funding. This is primarily federal fund stimulus funds for child welfare services and adult protective services that were allocated through the American Rescue Plan Act and the Coronavirus Response and Relief Supplemental Appropriations Act in 2021. The funding deadlines for using these funds vary. However, a majority of these are still available until the end of federal fiscal 23 or beyond. But as of now, it's anticipated that these are going to be one-time in nature. Turning to the fiscal 2024 budget, I'm just going to zoom out on this a little bit to fit this all on the screen here. As you can see, as I mentioned earlier, the budget is a total of about $690 million. And as you can see on Exhibit 4, a little under half of the total budget is for the foster care maintenance payments program, which funds the costs of placements and other related expenses for the state's foster care program. The other portion of the budget outside of this area totals about $375 million, of which personnel expenses are the largest category, about 39% of the overall budget. The largest area of personnel and administrative expenses is for the child welfare services program. And you can see this chart also breaks out funding for the Montgomery County block grant, as well as the other portion I would highlight is funding for evidence-based prevention practices and the technical assistance for those services, which total about $8.5 million, and that's about a similar level as in FY 2023. The fiscal 2024 budgetary changes, these are shown on exhibit number 5 on pages 10 and 11. As I mentioned previously, the overall SSA budget decreases by about 13.8 million. If you look at the budget first, excluding the foster care maintenance program, the budget increases by about 5.2 million for other personnel and other operations expenses. First, I'd like to go over the personnel expenses, which increase by a total of about 11.1 million. This is accounting for the FY23 costs of the statewide 4.5% cost of living adjustment for state employees in November. The annualization of those costs in FY24 is about 2.8 million. And in addition to that, there are also just under 4 million additional salary enhancements for other adjustments, including step increases that the department has initiated for certain public facing staff. And then the largest increase in personnel area is for employee and retiree health insurance premiums, which grow by about $5.4 million. And this is consistent with other personnel in DHS. I'm going to turn to the bottom of page 11. This is showing other changes outside of foster care maintenance payments, and then I'll go back into specifically the foster care program in later slides. The largest increase outside of foster care maintenance payments and personnel, there's about a $4 million increase for child welfare services, for contractual services, for the Baltimore City Health Suite, as well as other contracts for children's mental health services and the reporting of those services. These are related to children in placements in Baltimore City and are required in order to maintain compliance with the longstanding consent decree that the Child Welfare Services in Baltimore City operates under. The second largest increase is 1.3 million for the Montgomery County block grant, which we talked about previously. And then I'm not going to go into each one of these individually, but the largest decreases, again, I mentioned these earlier, the two federal stimulus funds in FY 2023. So turning specifically to the foster care maintenance payments program, this program decreases by a total of 18.4 million. And if you look at the change, general funds versus federal funds, the largest changes in federal funds, there's about a $24.2 million decrease in federal funds. This is primarily due to changes in the amount of temporary assistance for needy families, or TANF funding, which is being allocated for the purpose of foster care compared to in previous years, as well as there are also some decreases to the total amount of Title IV-E funding reimbursement. So as a result, there's increasing general funds for this program. Looking at specifically the causes for the decreases in the foster care program, I'm just going to pull this down on the screen, focusing on this portion of the budget. So one of the main reasons for this overall decline is due to changes in caseload assumptions in the fiscal 2024 budget. There are lower overall caseloads assumed compared to those assumed in the FY23 budget. And this is more to align those with some of the recent actual caseloads we've experienced through the first half of FY23. And these caseload declines are offsetting some of the other changes in overall placement costs, which I'll talk about a little bit in some of the next slides. But I'm going to turn to exhibit number 6, which is showing specifically the average monthly foster care caseloads over the past several fiscal years. And this is broken down by type, breaking out the purchased homes and purchased institutions, which are generally some of the most expensive foster care placements, as well as the regular, which includes family home foster care, and then other smaller placements. So as you can see on Exhibit 6, there's been a general decline in out-of-home placement foster care over each year since fiscal 2016 through 2020. The average was about a 3% annual rate of decline. And then during the pandemic, this really accelerated in fiscal 2021. There was a 15.5% total decrease, and then continuing in FY22, a 7.3% decrease. In previous years before the pandemic, there was this general about a 3.3% decrease, consistent with efforts by the department to reduce overall out-of-home placements through providing of alternative family preservation and other services. However, during the pandemic, there was really more substantial increases due to the rate of child maltreatment reporting, and during the pandemic and the early on the closures of in-person schooling and other activities, there was less overall contact in person between children and mandated reporters of child abuse. As you can see on Exhibit 6, although the overall percentage year over year decline has slowed in FY23 to date, the level of foster care caseloads are still generally lower level than compared to pre-pandemic. In this section of the analysis on page 12, DLS is also asking DHS to comment generally on overall trends in foster care, and if it is anticipated that there will be any large rebounding towards pre-pandemic levels, as in prior years it was indicated that this would be a case after some of the large pandemic related impacts had stabilized a little bit. Then continuing on Exhibit 7 on page number 13, actually page number 14 in the document, this is showing the same caseload data for subsidized adoption and subsidized guardianship placements. As you can see, there's a similar declining trend across these placements. However, they are not as large of a decrease. Subsidized adoptions decreased by about 4.8% in fiscal 2022 and have decreased by an additional 3.6% during the first half of FY23. However, subsidized guardianships have decreased by a lower percentage in FY22 and have actually decreased, rather increased slightly during the first half of FY23. The reason for these variations related to other foster care is that guardianships and adoptions are more related to court activity, and as court activity resumed largely in person earlier on in the pandemic, this allowed for more placements through these options to continue. And then exhibit number 8 on page 15, this is showing a summary of caseload projections, both in the budget, the middle two, the second and third columns from the left are showing assumptions made in the FY23 budget. And then compared to that is the DLS estimate of caseloads overall for FY23, taking into account the actual caseloads over the first half of the fiscal year. As you can see, there's a pretty notable difference between the amount that was originally budgeted in FY23 and the estimate that DLS is making based on the first half of the year actuals. This is, as I was mentioning previously, at the time of the budget development in early FY23, there was some degree of uncertainty over whether caseloads would rebound at a faster rate and increase towards pre-pandemic levels. So there was a little bit of a larger caseload estimate included in the budget. However, as you can see from this chart, the current projections based on actual caseload data through the end of December are a little bit lower than what the estimate was. In comparison, the FY24 budget is using lower projections for caseload sizes, reflecting more in line of this most recent actual experience. And that's part of why you're seeing in the budget a overall decrease in the costs for the foster care maintenance payments program. The next section of the analysis is talking about the actual placement costs for each of the placement types. So I'm going to turn now to exhibit number 9. This is specifically showing for the 3 most expensive placement types: purchased home, purchased institutions, and minor mothers and infants foster care. You can see the increase over the past 3 fiscal year actual expenditures, as well as FY23 during the first half of the year, and then compared to the amount that is budgeted in the FY24 budget for the average monthly placement costs. This is taking into account in FY23 the provider rate increases that were included in the budget. For the purposes of these assumptions, DLS is using about a 10% estimate based on the amount of funding that was included in the operating budget last year. However, I would note that the actual rate increases are determined by the IRC, the Interagency Rates Commission. The fiscal 2024 budget in comparison includes about $5 million for provider rate increases. So as shown on exhibit number 9, the average monthly placement costs for all placement types have increased by about 15%. And if you look specifically at the purchased institutions placements, which is the red line on this chart, the top line, the most expensive placement type, these have increased by about 24% between FY22 and the first half of FY23. And in comparison, in the FY24 budget, as you can see from exhibit 9, there are slightly lower average monthly placement estimates included in the budget, about 4.6% lower for purchased institutions and 10.6% lower for purchase of home placements. So DLS is noting that to the extent that actual caseloads remain similar or grow compared to FY23 levels, this average placement costs and the increase for certain placements could have an impact on the overall number of expenditures in FY23 and FY24. So that leads into the final slide in this section, the foster care maintenance payments program forecast that DLS is making. So starting out with FY23, DLS is forecasting that at the end of the year, there will be an overall surplus of about 14.9 million. And that's primarily due to what I was talking about earlier with the actual caseloads being notably lower than the amounts assumed in the budget. In FY24, in contrast, DLS is estimating approximately a 14.2 million shortfall overall, with a larger shortfall of about 18.2 million occurring in general funds. And this is primarily due to some of the assumptions in growth and overall placement costs. DLS would note that this forecast also depends some to the extent of what the actual caseload sizes and growth in caseloads through the remainder of FY24 and the second half of FY23 is. If there are more substantial caseload increases compared to what is actually included in the budget, this could lead to the shortfall being larger or smaller depending on what those sizes are. Also impacting this forecast are the state's ability to claim federal Title IV-E reimbursement. Although the forecast is showing that the federal funds in FY23 and FY24 will have a surplus. As you can see, the year over year, there's a change, there's a decrease from 13.1 million to 4.3 million. That's reflecting estimates in the budget that are estimating a decrease in the overall number of Title IV-E funding reimbursement that will be estimated to be claimed. So I'm going to turn now to the personnel overview section of the analysis. And this is continuing. This is showing an overview of personnel data, and then there's a little bit more discussion in the issues section specifically related to child welfare services caseworkers. As you can see on page 18, the number of positions authorized is roughly similar. There's a 0.5 FTE increase due to an interagency transfer, but roughly the number of authorized positions is similar. However, the number of vacancies has increased since the past year. Currently, as of December 31st, there were a total of 435.7 vacant positions, or about 16.6% of the SSA authorized positions. This is over double what is budgeted for the turnover expectancy, about 7.2% turnover expectancy. And the December 31st, 2022 personnel data is showing that vacancies within SSA have increased by about 93 total positions since the end of FY 2021. So I'm going to come back to this during the a few future slides in the analysis, but I'm going to turn now to the issues section of the analysis. The first issue that is discussed is reporting on out-of-home placements by both DHS and the Governor's Office of Crime Prevention, Youth and Victim Services, or GOCPYVS. GOCPYVS includes the former Governor's Office of Children, and they also serve as the chair of the Maryland Children's Cabinet, which along with DHS membership is an interagency organization relating to services for children in out-of-home placement and policy development. So annually, GOCPYVS issues a out-of-home placement report and family preservation research plan, which includes various reporting and strategies related to children in out-of-home placement across not just DHS, but other child serving agencies in Maryland. So I'm going to turn to exhibit number 11 on page 20. This is showing, as reported, there were a total of 6,382 youth experiencing at least one out-of-home placement across all child serving agencies. And specifically to DHS, there was 5,794 in FY 2022. As you can see, the year-over-year comparison in Exhibit 11, this is showing a general decline consistent with what I was mentioning previously in the foster care caseloads within DHS. There's about a 17.6% decrease in total out-of-home placements across all agencies between FY 2019 and FY 2022. Focusing specifically on out-of-home placements within DHS, I'm going to turn to exhibit number 12, which is showing the categories for these placements within DHS. So as I mentioned, the total was 5,794, and the largest share of these, about 4,863, were placed in family homes. The second largest category were community-based placements. Overall, out-of-home placements through DHS have decreased about 11.4% since fiscal 2019. Then exhibit number 13, this is within DHS specifically focusing on out-of-state placements in FY22. There were a total of 246 youth experiencing an out-of-state placement, primarily occurring in the states bordering Maryland, including Delaware, Pennsylvania, Virginia, and Washington, D.C. This chart is showing, you'll notice that the total for the various categories does not add up to 246 because it's referencing some youth who experience more than one placement during the fiscal year. Again, the most common placement type is with family home foster care, but as you can see, specifically for out of home or out of state, out of home placements, hospitalization is a large component of the out of state placements. Exhibit 14 on page 22, this is the rate of removals into foster care within DHS. In FY22, it was similar to FY21, 1.2 removals per 1,000 children under the age of 18. And as I mentioned previously with the foster care caseload discussion, this is consistent with efforts by the department for reducing the need for out-of-home placements through other alternative in-home services. The other data point in this section, Exhibit 15, is the percentages of rates of re-entry into foster care after 12 months of exiting. This is broken down between both exiting to reunification through family of origin and also exiting through guardianship. The chart is showing that overall the trend is there's been a decrease of re-entry into foster care. But as you can see from this chart, the rate of re-entry is generally higher for re-entry into reunification versus re-entry into guardianship. The final portion of this section of the analysis discusses some of the factors for removal into foster care. During the interim over the summer, DLS had asked DHS to provide some more information on some of the factors and the number of children removed into foster care. And DHS provided data that showed that there were a total of 1,618 children statewide removed from their homes and placed into foster care in fiscal 2022, with the largest number being from Baltimore City, Baltimore County, Prince George's County, and Montgomery County. DHS pointed out that the most common factors at removal identified in FY22 were neglect, which was the most common, about 53% of removals statewide, followed by parent substance and or alcohol abuse and housing insecurity issues. Of note, the issue of housing insecurity saw the largest year-over-year increase, about a 5% increase compared to fiscal 2021. So in the text of the next page, on page 24, the second paragraph, it provides a little bit more context into the legal definition of neglect. This is a fairly broad category, but the Federal Child Abuse and Prevention Treatment Act defines neglect as any recent act or failure to act on the part of a parent or caretaker that presents an imminent risk or serious harm to the child. There's also a definition in the Code of Maryland Regulations, or the COMAR, which provides a similar definition. This category can refer to many cases of neglect to provide for a child's basic needs, including food, shelter, clothing, medical care, or supervision, along other needs. And through research provided, academic research, there's shown that there's a pretty substantial correlation to instances of neglect and economic insecurity. Chapin Hall, which is a research organization at the University of Chicago that specializes in child welfare policy, has provided studies that nationwide, about 60% of substantiated child protective services responses involve neglect only, and overall about 85% of families investigated by Child Protective Services nationwide earn below 200% of the federal poverty level. They also point out that nationwide since the 1990s, if you look at overall trends, while rates of child abuse from physical abuse and other factors have generally declined over the past several decades, the rate of child abuse findings related to neglect has generally stayed similar since that time. The next section of the analysis relates to the Family First Prevention Services Act. And we've discussed this in budget hearings in prior years. This was part of a federal legislation enacted in 2018. And one of the main changes is changing the state's ability to claim Title IV-E federal fund reimbursement for expanded uses, specifically for prevention services programs. Exhibit number 16 on page number 26 is showing specifically 4 of these evidence-based prevention practices implemented by jurisdictions in Maryland under the FFPSA. As required by the FFPSA, prevention services must be trauma-informed and evidence-based, and the state must provide a Title IV-E prevention services plan indicating some of the practices that it is planning on implementing. So exhibit number 14, the summary of this is that there were 253 total families statewide served through 17 jurisdictions implementing. There were 17 jurisdictions that implementing at least one of these practices. DHS has indicated that a 5th practice will be implemented, planned for FY23, and that continuing implementation of practices is ongoing. The federal Title IV-E clearinghouse, which evaluates these practices, continues to add additional practices that are eligible for federal funding. So this implementation is ongoing. The other component of the PSA is related to qualified residential treatment programs. One of the other main provisions of the federal legislation is related to the reimbursement for non-family placed placements, specifically in higher levels of more residential treatment facilities and other higher levels of care. The FFPSA seeks to change the eligibility for reimbursement to promote placement of children with the lowest intensity and least restrictive means of treatment. So under this provision of the FFPSA, DHS and the Department of Juvenile Services worked together to develop a QRTP designation process. And during calendar 2022, DHS and DJS designated the first 6 of these QRTP providers. And this designation process is also ongoing. And page 28 of the analysis provides some additional discussion of the required components for a residential treatment center seeking QRTP designation. I'm going to turn now to some additional personnel discussion. Exhibit number 17 is providing data on child welfare caseworker and supervisor positions and comparing the number of current filled positions across jurisdictions to the caseload standards divided by CWLA, the Child Welfare League of America. The Child Welfare League of America develops caseload standards based on different areas of child welfare services. These include both social workers, 4 different foster care caseloads, as well as intake, investigation, and other areas. For the purposes of this analysis, DLS has added up the aggregate totals of caseworker and supervisor positions needed per jurisdiction. And overall, this is showing that statewide, there were 933.5 total positions that would be needed to meet the CWLA caseworker standards. And there were a total of 1,071.6 that were filled across all jurisdictions for a surplus of about 138. However, this analysis on Exhibit 7 is showing that there was some variation depending on jurisdiction in the state, and that in fiscal 2022, this is as of September 1st, 2022, at that time frame compared to the previous calendar year, there were 6 jurisdictions statewide that failed to meet these caseload standards. In comparison, in the previous year, September 1st of 2021, there was only 1 jurisdiction that failed to meet the standard. And although overall statewide the standard is being met, overall the number of filled positions needed has increased by about 27 from about 906 to 933. On page 29 of the analysis in the text, DLS is noting that some of the factors allowing DHS to continue to meet these standards is due to some of the decreases in overall caseloads that we discussed previously. And DLS has continued to meet these standards despite the fact that there are continually high vacancies and actually increases in vacancies year over year in these positions. In response to the overall vacancy rates in DHS SSA, DLS is asking DHS to comment on efforts to increase the number of filled caseworker and supervisor positions, and specifically in Baltimore and Prince George's counties, which are 2 jurisdictions which failed to meet the standards as of September 1st, 2022. And these 2 counties also had the largest shortfalls among jurisdictions for caseworker position standards. On page 31 of the analysis, the text also notes that the Child Welfare League of America, CWLA, has recognized recently that maintaining adequate caseload ratios alone is not a sufficient measure of the adequacy of child welfare staffing, and has indicated that there are other components that should be analyzed as well, including the workload standards associated with cases, in addition to simply looking at the number of cases a caseworker is responsible for, also looking at the amount, the complexity, and the intensity of the work being assigned. CWLA has indicated that it is looking to conduct additional workload studies as part of this effort to develop new workload standards. And DHS has indicated that in the future, it would also take this into account. So I'm going to conclude by going through the DLS recommended actions, which begin on page 32. DLS is making 6 total. The first is requesting committee narrative replace in relation to hospital overstays and the length of stays in emergency rooms. This was covered in the DHS overview budget analysis and the budget hearing for that analysis in depth. So we didn't cover that again today, but in prior years, this committee narrative has been included in the Social Services Administration analysis, and similar to previous fiscal years, DLS is again recommending committee narrative to request updated reporting on this data at the end of calendar 2023. The second recommendation is requesting committee narrative related to the Family First Prevention Services Act, providing updated data on the evidence-based practices being implemented, as well as an update on QRTP designation as of the end of calendar 2023. And then the third recommendation is related to implementing of a new foster care provider rate structure. This is similar to narrative that's been requested in previous fiscal years. I didn't discuss this in my presentation, but towards the end of the analysis on pages 37 in the update section, there is further discussion on the timeline that DHS indicated in its reporting this year on the implementation of a new provider rate structure. Currently, that is anticipated for implementation in calendar 2025. In fiscal 2023, there has been work on executing a contract with a vendor for actuarial services related to that contract. So recommendation 3 would ask for narrative providing an update on where the process for that stands. Recommendations 4 and 5 are annual budget bill language, which restrict funds in the foster care maintenance payments program and the child welfare services program to those purposes, and also require that any unexpended general funds at the end of the fiscal year shall not be transferred but reverted to the state's general fund. And then the final recommendation, recommendation number 6, this is similar to in previous years. This is a committee narrative asking for updated child welfare caseload data. And then the recommendation this year, DLS is also recommending asking for additional discussion on efforts to fill vacant caseworker positions. I think I will end the presentation there, and we can take any questions at this time. Thank you.
Thank you, Mr. Quest. And seeing no questions from the committee at this time, I'd like to bring up Secretary Lopez and his team.
Wait. Good to go? All right. Good afternoon, everyone. Honorable members of the committee and Chairman McCray, my name is Rafael Lopez, and I'm the Acting Secretary of the Department of Human Services. Thank you for the opportunity to discuss our department's Social Services Administration budget for fiscal year 2024. Joining me at the table to my left is Denise Conway, Executive Director of the Social Services Administration, and to my right, Stafford Chipungu, our Chief Financial Officer. In addition, I am joined today by Daniel Waite, Acting Deputy Secretary of Administration, Michael Ademidenko, Deputy Executive Director for Programs in the Social Services Administration, Kimberly Parks-Bourne, Deputy Executive Director for Permanency and Placement, Brandy Stocksdale, Director of Baltimore City Department of Social Services, and Carnita White, Director of Anne Arundel County Department of Social Services, for just a few more days. Of note, we are being intentional about including our partners from all 24 jurisdictions for our budget hearings and setting the pace and tone for our work together by strengthening our relationship with the Maryland Association of Social Services Directors, or MASD. I'm also thrilled to share with you that Carnita White has accepted our offer to become our department's new Deputy Secretary. I trust Carnita's judgment. She leads with ethics and integrity. She never shies away from hard work. She is widely respected across the state of Maryland. She understands the delicate balance between state and local partnerships. And most importantly, she's passionate and has a heart of gold. Carnita represents key foundational pillars of how we will lead moving forward and create the next generation of human services together. Before diving in, I want to thank Samuel Quist, like I think I'm thanking you every day, for his comprehensive analysis of our budget. What else would I say, right? But thank you, Tom. All of you have received my written testimony, so I'll only lift up key items now. And as I've done in previous settings, I'll speak to windows into the future and call upon my colleagues to speak about decisions that were made prior to my arrival. Top of mind for me as a newest member of the DHS team are the over 1 million Marylanders who we have the honor of serving every single year. So first, I'd like to turn our attention to the recommended actions and issues. We concur with the 6 recommended actions And in summary, we will proactively, 1, share actionable data on hospital stays and out-of-home placements. 2, provide updates on the implementation of the Family First Prevention Services Act. 3, share implementation progress on the new foster care provider rate structure. 4 and 5, monitor and strengthen the use of general funds in the foster care maintenance payments program, as well as child welfare services at large. And finally, number 6, we will persist in how we will maintain appropriate caseload standards that are directly linked to recruitment and retention of caseworkers and social workers across the state. Next, I'll turn our attention to the 5 issues brought to the department's attention. Issue number 1 on page 5. This one specifically asks us to discuss steps in reducing the rate of victimization for youth in foster care. Overall, the Social Services Administration is currently using a variety of tools to reduce the rate of victimization by a variety of strategies, and I want to lift up 4 of them. 1, by increasing the use of data analytics and case management practices. 2, caseworkers increasing their in-person engagement and communication with children in foster care. 3, by conducting quarterly monitoring visits for all out-of-state placements. And number 4, enhancing the electronic management system to improve accuracy in reporting. Next, I'd like to turn our attention to issue number 2 on page number 6. This one pertains to having the department comment on steps that we plan to take to minimize placement moves and to minimize the impacts of such moves to disruption in youth in our care. First, the team is engaged in a variety of strategies to both address the permanency needs of our youth in care, as well as to minimize placement disruptions. These efforts include pursuing targeted recruitment as well as retention strategies for foster parents, meeting specialized training needs of our foster parents, exploring more formalized mentoring for our foster parents, engaging in rate reform across the state, resubmitting a request for proposals for respite, diagnostic, and evaluation of treatment provision, or DETP services, and finally, providing detailed jurisdiction data to local department staff to help more effectively evaluate the needs of children in care. Next on our list is issue number 3 on page 12. This is asking us to comment on overall trends in foster care caseloads since fiscal 2021 and the impact of pre-pandemic levels. Simply put, we do not expect the caseloads to return to pre-pandemic level next year or in years to come. None of us should want to ever see an increase in the number of children in foster care. Specifically, we must now be much more strategic about serving the needs of children in our care, which are presenting with ever more complex needs. Our kids deserve our boldest thinking as we imagine a different type of response than the department has traditionally given. Next, the Family First Prevention Services Act provides us the opportunity to do just that. It allows Maryland to dive deeper into preventative work that will help us ensure that children and their families receive the right kinds of support necessary to keep them out of foster care in the first place. Finally, the Family First Prevention Services Act Title 4E Prevention Plan is currently undergoing review to include the expansion of new evidence-based practices, as Sam lifted up, to better support the needs of families and children in their homes. I've already expressed to my colleague Denise Conway that as head of the Social Services Administration, I intend to scale more preventative measures on the front end and will work closely with her and our federal partners to expand such access in the state of Maryland. Issue number 4 on page 25 asks us to comment on the status of approval of the cost allocation plan and its ability to seek federal reimbursement while the cap is pending. Currently, the department has submitted a cost allocation plan for approval. I was stunned when Denise told me it was submitted in 2020. This is the very office I led in the Obama administration, and 3 years is a long time to wait. So we're going to find out why it's taking so long to get an answer. We were told that we got a verbal yes to our plan submission, but until I see it in writing from whoever is in that current chair now, Sam will not accept that, I imagine. So we are going to follow up with a phone call and ask why it's taking so darn long to get a response to the state of Maryland. In the interim, the department has been claiming Title 4E reimbursements based on the proposed plan, but we do need it in writing. Finally, on issue number 5 and on page 29, you are asking us to comment on efforts to increase field caseworker and supervisor positions in Baltimore County as well as Prince George's counties, which failed to meet the standards for both types and had the largest shortfalls among jurisdictions for caseworker positions. So as we've shared with several committees now, we are reimagining how we're doing our recruitment and retention strategies. We have to reduce the barriers to entry to get into our shop, making us a more attractive department and employer of choice. We are working proactively to fill those vacancies, and we have shared this plan with multiple committees. We're trying to streamline those processes. And I want to lift up an example. When we do recruitment at fairs, why is it that so many other people across the country can make a spot hire, for example, pending background checks and pending an investigation? We should be doing those kinds of things here in the state of Maryland to show that we want to fill those vacancies much quicker than we have in the past. We're already working with DBM and others across the administration to put those practices into place in the next couple of months, and we'll happily share with you the results of our work. We're also trying to provide the balance between work and personal well-being and offer more competitive compensation. Clearly, we have more to go and room to grow there, but we want to be dedicated in our seriousness to this effort in attracting more people. Our acting Deputy Secretary, Dan Waite, and Denise Conway, head of the Social Services Administration, will be working specifically with Baltimore and Prince George's counties, local social services director, to rapidly prototype these various strategies and see if these might help fill those vacancies in the next couple of months as well. So we'll test those out. This concludes our testimony, and we'd be happy to answer any of your questions.
Thank you, Mr. Secretary. I was going to start when I was reading your report where it said you were joined by two of my favorite directors. But I would also like to agree with you in reference to Director White is going to make a phenomenal Deputy Secretary. So
Indeed.
Thank you for your leadership.
Absolutely.
I only had one question.
Sure.
And let me be clear, I talk to my director all the time, but when I looked at Exhibit 17 on page 30, the only thing that raised some red flags was the 34 vacancies in the supervisors. And I've heard the overview. I'm currently aware of how you talked about the job fairs, you talked about that. But like, under what time frame do you think that we will decrease these supervisors, I guess, is one of the questions.
Sure. Actually, if you don't mind, I'm going to also invite Director Brandy Stocksdale up to the table, and she could also answer some questions. So I can first talk about our strategy and then ask her to comment specifically on that particular question of the supervisors. One of the things that Brandy and I were talking about literally a couple of hours ago was being really thoughtful around what's the future look like with the consent decree, for example, and making sure that we understand where pins are, where actual humans are doing which jobs, that we're much more thoughtful about the way in which we're redirecting our work. Because as you know, pins in Maryland and live bodies are oftentimes two different things, as are the process functions in individual jobs. So what it's going to require Brandy and all of us to do with Dan and with Denise and the leadership team at SSA is reimagine how we do that to better support Brandy, to better support the people of Baltimore City. So that's sort of the strategy we're working on right now. And I'll turn it over to Brandy to comment specifically on the supervisor vacancies.
Yes, so thank you, Mr. Chair. Thank you, members of the committee. Our supervisor vacancy has been an issue for a while now, really started during the pandemic. And so all these years that I have been in this work, I've actually never seen so little applications coming to us to even get an interview. And so the supervisors are at the clinical level, right? So they're licensed clinical social workers. We have been able to bring in workers at a pretty good rate, but the clinical social workers are not applying for these jobs right now. And so I am excited to work with Secretary Lopez and my other colleagues to really do some recruitment of that population, because we are definitely, we have a great need, specifically in Baltimore City. And in order to retain the workers that we're bringing in, we need to have clinical supervisors there to meet their need.
Thank you, Madam Director. First, I just also want to acknowledge that we are joined by our chair, Chairman Gagazone, from that standpoint. So I just wanted to acknowledge Mr. Chair. Just because we have a number of people that want to give public testimony, I wanted to give you the opportunity to just comment on some of the things that I was reading from the public testimony.
Absolutely.
It strictly dealt with the budget. It talked about raising the percentage from 11 to 12%. I'm sure that you heard that. And it talked about raising the 5 million to 15 million. I just wanted to give you the opportunity just to comment if you had anything to say.
Sure. I guess it would be helpful. I haven't seen the testimony myself. I will say I try with our team to begin to model with them what it looks like to anticipate both your questions and our colleagues, partners. So first I think rates are one of the issues that I imagine has been brought up. I just said to Kevin Keegan in the hallway that it is a new day and we have to think about rate restructuring, not just for how we invest deeply in nonprofit organizations and private sector partners, but developing a robust pipeline of services for kids. I will tie that to something else that's both been in the press, as well as one of the requests that the committee has had around the issue of hospital overstays and children in placement in hotels. I want to say for the first time on the record that I will work with our department to actually end that practice. I do not believe that it is the right thing to do for kids. The science worldwide on trauma, the science on early adolescent brain development, the impact on not just the families of those children, but the children themselves, the impact on our staff. Hotels are not placements for kids. I fully understand that prior to my arrival, the state had to make very difficult decisions. I don't have a magic wand, but if I don't help raise the bar of excellence, say we're not going to do that, we can't reverse engineer to a day where we imagine that no child will live in a hotel, whether it's for 1 day, 2 days, or 10. So in preparing, we took a look at where the kids are. There are, as of today, 26 children across the state of Maryland. I know which jurisdictions, I know how long they've been there. And we will begin to model how to get to a place in Maryland where no child is in a hotel. Similarly, one of the issues that I know that our advocates have brought up consistently, and I'm listening to very seriously, is being proactive in developing a longer-term comprehensive strategy around hospital overstays. Again, which is balanced between an intentionality behind the state of Maryland reducing the number of out-of-home placements and out-of-state placements, which is a good thing, but balancing that with a deep investment and growing the population of providers and a robust set of services here. That's going to require a very different kind of proactive, almost emergency-like behavior in the next couple of months to begin to realize this vision. But I want to state simply in here for the record that we are not going to move forward in an environment or a culture which sustains the placement of children living in hotels, full stop.
Thank you, Mr. Secretary, as usual. Just want to say thank you to the agency. Thank you to all of your leadership, but more importantly, just congratulations again, future Madam Deputy Secretary.
Right.
And Mr. Quist, just want to double down on Mr. Secretary's comments and just say thank you for your comprehensive analysis. Seeing Senator Hettleman.
Thank you very much, Mr. Chairman. I have to say, thank you very much for that statement. Actually, my colleague across the way and I dealt with the situation last year of a child who happened to be in both of our jurisdictions, but it was pretty awful.
It is.
And so I just congratulate you and look forward to hearing kind of what the alternatives are.
Absolutely.
One of my questions is, you mentioned, certainly with regard to this issue, a different kind of response than what this department has done, I think was the exact quote or close to it. And I just want to know if you can flesh that out a little bit.
Sure.
Show us what that looks like in your mind.
Sure. Well, one of the things I've done, I should correct myself. It's interesting. I take my glasses off to look right in front of me, but I need them to look at you. And I misquoted my number. It's actually 28 youth in 9 jurisdictions in a hotel. I want to correct that for the record. One of the things that I've been doing with Denise and members of the leadership team is try not to surprise them by saying things publicly that I wouldn't tell them privately, but also try to pace. And so I want to both acknowledge that as I've gotten to know the team, how hard they've worked under challenging circumstances, and trying to now extract some of the ideas that perhaps they weren't able to implement and try to test those out. So there's a combination of both. How do we do that and rebuild the team, rebuild an executive leadership team, but very clearly tie the future of human services in the state of Maryland to the science and literature. So for example, we have decades worth of history that tells us that when we place children with kin, they do better off. But the way in which the country and this state has historically funded kin services is not the way that our budget looks right now. We're gonna have to look deeply at that and course correct it and flip the script. So 1, how do we invest in kin? 2, how do we grow a robust set of comprehensive services to meet the complex needs of kids that are presenting to us right now, which are oftentimes the very kids in hospital overstays or hotel placements. If you say we'll never have them there, what's the backup plan? Right now, it's a constellation of emergency kind of supports. Our staff are running around trying to fill them. That's not a way to be on the offense. So rather than playing defense, how might we change that behavior, honor the staff and their ideas, and test new ideas out, all in the spirit of rapidly prototyping, failing fast around them so that we can have a comprehensive set of services within a year, right? It won't take us forever to test them out quickly. I think another solid pillar of this is, again, what does the literature tell us about closing down as much of the child welfare system as you can, which is that if we spend our time investing and digging for gold versus digging for dirt in families, we'll actually see better outcomes for those families, which is how do we help them before we remove their child? If they're struggling on neglect, I was commenting to Denise, neglect is a shadow indicator we're in this country for being poor. So we're gonna punish you for being poor, worry about checking your refrigerator or your cabinets, you don't have enough money, and then we're going to remove your child if you happen to be a survivor of domestic violence. That story and that pattern is old and tired and useless in my mind. So how are we going to actually look at neglect in a very different way, potentially work with you to change COMAR standards and be a state in the nation that's leading on this practice, reducing the number of kids that age out of our care into corrections or into homelessness. These patterns, the data's there, but our staff struggle to even put it together in a comprehensive way. That's about all those pillars I talked about and imagining setting a high standard of excellence in a very, very different way. So when I talk about doing things slightly different than has been done, I'm referencing not just the science and the literature, but lifting up our people, lifting up our staff, and all of that should be framed by youth and family voice, centering their voices and their experiences and testing out new ideas in that space.
Feels like a new day in Maryland. Thank you.
Senator Zucker.
Thank you very much, Mr. Chairman. Mr. Secretary, thank you for you and your office's responsiveness. You know, when you talked about trauma, it's interesting you mentioned 1,600 kids that are being removed from their home going into foster youth. And this weekend, when I was thinking about foster youth trauma and then reinforced by what you said, you have these kids that are kind of moving along. And from what I've heard from people on the ground is they're given garbage bags when they're moving. And, you know, that might reinforce how they feel about themselves, certainly not the value that we feel that they are and the importance that they play in our community. So I've reached out to your agency, but anything we can do to partner to make sure that when kids are coming into the foster system, that they're given bags. And if they're moving, they're not having to pack up all their lively possessions into a garbage bag and taking that with you. So I look forward to working with the committee and you on reflecting the true value of these foster youth.
I will, Senator, absolutely look into that. I didn't know that was still happening in 2022 or 2023. Is that happening still?
No.
Okay, so we're gonna have to figure this out.
No. Yeah.
Okay.
And we have preliminary feedback
Okay.
from our local departments, so that is not the norm. And a lot of our local departments partner with community resources. They even have staff that will come in and bring, whether it's a duffel bag, a new suitcase, a book bag. And so while we can't say definitively that there is not a single child that is using a garbage bag, we have the resources to make sure that each child that is in foster care has a suitable vessel for their belongings.
Well, that's great because that was something I heard recently. So hopefully it was just a one-off. So thank you.
Well, and it should never happen is the
Right.
bottom line. So the trick then is how do we institutionalize a culture that says together we'll never have that happen? And so then to our staff, how do we support them to make sure they have the resources available? And there's lots of great ideas across the country. I've actually visited a couple when I was responsible for child welfare under the Obama administration, and they had almost like a store-like department store, and kids who'd been removed, they go into the place and they shop for their stuff. It doesn't look like a shelter. It's just how you treat the child to say, we want you to have a nice shirt, a nice jacket, pick your duffel bag. That's a very different approach than the staff feel that they've been empowered. They don't feel like they're being blamed. The children don't feel threatened, and it heightens the experience. Why would we expect anything less for our kids?
Thank you, Mr. Secretary. And at this time, we're going to call up some of the folks that wanted to give public testimony.
Great.
We'll start with Mr. Kevin Keegan from Catholic Charities.
Thank you, Mr. Chairperson, members of the committee. My name is Kevin Keegan from Catholic Charities, and let me first say I agree. It feels like a new day. So the written comments I had here is full of notes just from the past half hour of listening, which I think represent a certain amount of excitement. And I will just pile on the compliments. If his first decision is any indication of things moving forward, hiring Carnitra is a great decision, although for our local work in Anne Arundel County, we're a little sad because working with her as a local director for our Anne Arundel County Clinic has just been amazing. We've gone from 190 kids in our residential programs at Catholic Charities to 75. That's been over about the last 12 years. aligned with that, we have grown the work in our outpatient community mental health centers that stretch from Cumberland to Harford County to Anne Arundel County through Baltimore City and Baltimore County and Frederick. We've grown them to include substance use services. We've grown them to include same day services where people, when they're ready, they can call us and we can get them in same day. Not everywhere yet, but that's a priority for us. The reality is those two things have to happen in common, and things have become out of balance because as the push was made, going back 12 years ago to reduce the utilization of residential programs, those community-based, family-based services just haven't fully been developed. And what I've heard from our new Secretary of Health as well as our new Secretary at DHS, in fact, they both testified together the other day, which was really just a wonderful thing to behold, and to hear acknowledgement that the foundation of a system of care is built on family voice. That's where it begins. And the reality is, when you ask the question, the leading cause of kids coming into care is neglect, but nobody neglects their kids because they want to or because they don't like their kids. They do it because they're distracted by other issues that are on their minds. And frequently, the second leading cause is parental substance use. The big part of that neglect category is also parental substance use and other mental health issues that really distract a priority of someone to be able to prioritize their child, sadly. But the people who are charged with neglect care deeply about their kids. And they want to take care of their kids, and with the right supports in place, we can help to make that happen. You don't have to look any further than a number of the local departments, such as Anne Arundel County, such as Allegheny County, where both counties where we're doing PCIT, it's parent-child interaction therapy. And I don't have time to go into the details on that, but it's one of those evidence-based strategies that helps families stay together. In Baltimore County, we're working with the local Department of Social Services and the local management board to implement what's called CBT+. It's a trauma-informed approach. And then in the city, we're working closely between DSS, our local behavioral health authority, and our local clinic to provide crisis services to those families where we're trying to keep those families together, the foster families as well, so that they don't have to be removed. I do want to speak to the issue of provider rates. The reality is that we all agree, we don't want kids in high-end care. But the reality is that the kids that are then left in high-end care are the most challenging. And there's not any exaggeration. It's tragically and sad, but they're very, very challenging. And more than that, they're individualized. And part of the challenge with the rate setting system, as it's been for years, is that it's one size fits all. One building, one rate. So you don't have any individualization, any unique care that you can build around an individual child to help them be successful. So the rate, it is critical that rate system be fixed. It's also critical that, we are no different than the departments and no different than schools and police. We're competing for staff now like I've never seen before in more years than I'd like to say at this point. And it's really critical that the providers of those high-end foster care services receive similar increases as those who were paid by our Medicaid rates and paid through our DDA services. So we would ask not only that the committee completely supports the SSA budget, but also considers more of an allocation towards providers being able to have parity to other rate increases proposed this year. That I'll conclude there, and I'm happy to answer any questions.
Thank you.
Thank you.
Seeing no questions, we'll bring up the next person, Mr. Robert Basler.
Good afternoon. Thank you, Mr. Chairman. Thank you, members of the committee, for hearing me. My name is Robert Basler. I am Associate Vice President, excuse me, at Arrow Child and Family Ministries. We are a multi-service agency. We serve over 500 youth a year in a variety of services, including now 2 of the new QRTP programs in the state, as well as treatment foster care. I will not repeat everything that Kevin just said because I echo most of it. Like Catholic Charities at Arrow, we are completely invested in what the secretary said today and in working with and supporting the department in providing the absolute best care for kids and keeping kids out of foster care when possible, and when they do need high-end care to provide that. I think at Arrow, we were very lucky in the last year with the QRDP designation. It allowed us to do a renegotiation of rates that's not normally possible. It honestly prevented one of our residential programs from closing. The program had gone multiple years with either flat funding or almost no rate increases, in part due because of the way rate structures are done and how we are compared to other programs. We built in a lot of clinical services that not all programs had to meet our clients' needs, and that put us sort of outside the standard deviation of rates. But we were able to successfully get young women mostly into family settings and out of residential care. Despite that, that got us to a good place, but as you will read in the written testimony I submitted, we still struggled to hire staff. We had, since between 2019 and 2022, we saw a 33% increase in our staffing costs. I think next year we're anticipating a 10% increase in our insurance costs. And obviously we have to clothe and feed young people, and that, especially with serving mostly teens, they eat a lot of food. And so we really do need, in order to have the staffing and provide the quality services that these kids need, a rate increase that is comparable to what mental health, what DDA, other providers are getting. So again, I would ask that a favorable reading on the overall budget and to allocate more funding to private providers as well. And again, I'm happy to answer any questions.
Thank you. Seeing no questions, I'm going to call up our next witness, Ms. Cindy Smalls from AFSCME. Not seeing Cindy Smalls come up, we'll call up our next person, Teresa Hessler.
Good afternoon, Mr. Chair and members of the committee. For the record, my name is Teresa Hessler, and I'm here today representing the Maryland Association of Resources for Families and Youths, also known as MARFI. I'd like to first welcome Secretary Lopez. It truly does feel like a new day in the state of Maryland, and we are very much looking forward to working together. The members of MARFI represent providers who serve Maryland's most vulnerable children who are in and out of home placements due to abuse, neglect, or severe mental health or medical needs. Our members are social workers, operate group homes, treatment foster care programs, and independent living programs, primarily serving the foster care population as well as juvenile services population. As you will see in the numerous written pieces of testimony submitted by our members, we are here today to ask that the governor's fiscal 2024 allowance for SSA match that of Medicaid providers at 11 to 12%, and that the amount appropriated for the IRC increase goes from $5 million to $15 million. These valuable funds are critical in allowing DHS and our providers to continue their good work and remain financially solvent. While there are many barriers to providing the care that Maryland's most vulnerable populations need, inadequate funding currently by the state providers is one of the largest. By increasing the percentage for provider funding, we can remove additional barriers, workforce shortages, hospital overstays, and many of the other things the people that testified before me mentioned. We thank you for your consideration for the vital funding increases and look forward to a productive partnership with the department and General Assembly to address these challenges and find solutions, providing life-saving services to many of Maryland's most vulnerable. Thank you.
And thank you, colleagues. Seeing no questions at this time, we'll end the hearing for DHS Social Services. And we will bring up our next analyst, Mr. Jacob Polikoff, for the Executive Department of Boards, Commissions, and Offices.
Except for the fact that I'm taller than Sam. All righty. Thank you very much, Mr. Chair, members of the subcommittee. I am here today to talk to you about the Executive Department's Boards, Commissions, and Offices unit. There are a number of programs included in this unit, including survey commissions, the Governor's Office of Small Minority and Women Business Affairs, which we'll be referring to as GOSPA, the Governor's Office of Community Initiatives, the State Ethics Commission, the Healthcare Alternative Dispute Resolution Office, the State Commission on Criminal Sentencing Policy, the Governor's Grants Office, the State Labor Relations Board, the Governor's Coordinating Office's Shared Services Unit, the Board of Contract Appeals, and the Maryland Core Program. This analysis does also continue to reflect the budget for the Maryland Commission on African American History and Culture, which had formerly functioned within GOCI. The Maryland Commission on African American History and Culture operates the Banneker Douglas Museum and makes funding recommendations for the Maryland Historic Trust's African American Heritage Grants. Chapters 451, 452 of 2022 established MCAHC as an independent agency, but it remains included as part of this analysis for fiscal 2024. We see at the bottom of page 1 that the fiscal 2024 budget increases $1.2 million, or about 4.7%, to $26.3 million. On page 2, we have information on a couple of proposed deficiencies for fiscal 2023. The first one is $639,916 in general funds to fund a settlement for claims raised by the U.S. Department of Justice concerning the administration of AmeriCorps grants within the Governor's Office on Service and Volunteerism. These claims brought by the U.S. Attorney for the District of Maryland included violations of the AmeriCorps grant requirements, improper charging of salaries to the AmeriCorps grant, and overcharging AmeriCorps on certain federal financial reports. The settlement also included a 3-year compliance agreement wherein AmeriCorps will govern and monitor GOSV's AmeriCorps awards to ensure compliance with grant procedures. And DLS is asking GOSV to comment on what internal changes can be made to prevent a reoccurrence of issues which led to this settlement, as well as any other changes made to alleviate issues created by the settlement. Additionally, there are a couple of other deficiencies, just over $142,000 in general funds to fund the Minority Business Enterprise, MBE, ombudsman position, along with 2 compliance positions. Funds to support a dedicated fiscal position in the Governor's Office of Community Initiatives, both general funds and special funds to supplement the appropriation for the reclassification of 4 positions at the State Ethics Commission. General funds to fund contractual salary adjustments for the State Commission on Criminal Sentencing Policy, and general funds to fund 3 Maryland State Board of Contract Appeals board members, as well as 3 law clerks. On page 3, you'll find Exhibit 1 providing a breakdown of agency spending by program. We'll see that the largest program in this budget is the Governor's Office of Community Initiatives, which occupies about 40% of the total budget. The next largest program is the Maryland Core Program, which is responsible for 19% of the budget. Other programs in this office account for less than 10% of the unit's total budget each. On page 4, we find a breakdown of this year's budget increase of $1.2 million or 4.7%. As mandated by Chapter 451 of 2022, MCAHC gains $900,000 in this budget, bringing their total allowance to $1.6 million. And that's included in the 1.2 million figure. In terms of personnel changes, personnel expense changes, new positions add $548,000 to this budget. And the annualization of the November 2022 4.5% cost of living adjustment adds about $108,000 to this budget. Other significant changes include changes in contractual personnel expenses, which adds $259,000, and grants to state agencies, AmeriCorps grants to state agencies adding $255,000 approximately. On page 6, we have a discussion of personnel data. There are 6 regular positions and 2 contractual positions added in the fiscal 2024 allowance. 5 of the positions are for the Maryland Corps program. We see that there are currently 6 positions vacant as of December 31st, 2022. On page 7, we have the first key observation. The Maryland Commission on African American History and Culture, formerly being established as an independent agency, again by Chapter 452 of 2022. As an independent unit within the executive branch, the legislation also requires the governor include $1.6 million for the commission in the annual budget bill. As previously mentioned, MCAHC oversees the operation of the Banneker Douglas Museum. The commission also administers the African American Heritage Preservation Program with the Maryland Historical Trust. The Banneker Douglas Museum was affected by the COVID-19 pandemic. Oops, sorry about that. Was affected by the COVID-19 pandemic. As Exhibit 3 shows, engagement appears to grow substantially between fiscal 2019 and 2020, and again between fiscal 2021 and 2022. During the pandemic-induced limitations to in-person visitation, the museum shifted to a larger online presence and began including online interactions in its reported measure beginning in fiscal 2020. Starting in fiscal 2022, engagement data is reported as in-person visitation along with engagement via various online platforms. In-person visitors totaled 4,868 visitors in fiscal 2022, which is approximately half the in-person population that visited in fiscal 2019. The new metrics that the commission has begun to report with the fiscal 2022 actual data include tracking visits to the MCAHC website, as well as social media engagement with profiles for the museum on Facebook, Instagram, LinkedIn, and YouTube. By providing information and access in a virtual environment, MCAHC is able to increase awareness of themselves and the Banneker Douglas Museum. In fiscal 2022, the first year where this data is available, there were 153,508 interactions recorded with the MCAHC website, YouTube channel, and other social media profiles. And we have a full breakdown in Exhibit 4, which if you're following on paper is on page 8. The Maryland Commission on African American History and Culture should comment on how their operations have changed since becoming an independent agency, and plans for continued expansion and engagement with the community. Moving on to the second key observation on page 9, minority business enterprise participation does remain stagnant this year. The MBE was established in 1978 with the goal of promoting the inclusion of small businesses whose owners are socially and economically disadvantaged in the state's procurement and contracting opportunities. Since fiscal 2014, the goal for participation in MBE has been 29%, but this goal has been missed in each fiscal year since that point. Additionally, the previous goal was 25%, and that number also has not been achieved in any fiscal year since fiscal 2014. Exhibit 5 shows the level of MBE participation has remained mostly stagnant in recent years. Fiscal 2021 MBE participation was 17.1%, which was an increase from the recent low of 14.2% in fiscal 2020, but that is still 11.9 percentage points below the goal of 29%. GOSPA has increased outreach to the small business community in an effort to try to increase MBE participation, but this has not resulted in any substantial progression towards the 29% goal for MBE participation, nor toward the 15% goal for the Small Business Reserve participation goal. Events are hosted each year focused on educating and training members of the procurement community in an effort to increase MBE and SBR participation. In fiscal 2021, 31 events were held to train small businesses on the MBE program, and 12 events were held to train the procurement community. In contrast, there were only 36 events for small businesses in fiscal 2022, 5 more than the year prior. Only 10 events were held for the procurement community, which is 2 fewer than the year prior. And Exhibit 6, which is on page 10, illustrates the number of these events held each year. With MBE and SBR participation remaining stagnant for an extended period of time, GOSPA has collected data from participating agencies on their agency's MBE liaisons. In calendar 2022, 73 agencies were surveyed. Of the agencies surveyed, 64 submitted a response, and a total of 56 agencies reported having the role of MBE liaison filled in calendar 2022. One question on the survey was, what is the average amount of time the MBE liaison spends administering the program weekly? The answers from the agency liaisons are depicted in Exhibit 7, which can be found on page 11 if you're looking on paper. But we can see that 68% of the liaisons spend 10 hours or less per week administering the MBE program. The Department of Legislative Services recommends the adoption of committee narrative, requesting that GOSPA continue to collect and report the findings of the MBE participation and liaison attainment surveys in order to monitor the state's progress toward achieving its MBE goals. In addition, the agency should comment on how it utilizes the data gathered from the survey to improve MBE participation and discuss other methods that could be utilized for further increasing MBE participation and the impact of MBE liaisons. The third key observation made in this analysis is that volunteer activity remains low post-pandemic. The Governor's Office of Community Initiatives Volunteer Maryland program is tasked with developing volunteer programs that help to meet needs in multiple areas, including economic opportunity, education, disaster services, veterans, and military families, among others. Since the onset of the pandemic, multiple metrics used to track volunteer contributions in the Volunteer Maryland program have suffered significant decreases. One of the most changed figures is the value of volunteer hours and in-kind contributions. In 2018, the value of volunteer hours and in-kind contributions was $5.85 million, which has decreased to $1.32 million in 2019. And then in fiscal 2022, the value had decreased to $582,000. Exhibit 8, Exhibit 8 shows the full breakdown of the value of volunteer hours and in-kind contributions between fiscal 2018 to fiscal 2023. Volunteer hours contributed to the state fell by more than 70% between fiscal 2020 and 2021, falling from over 58,000 hours to 16,940 hours. Although there was modest growth in fiscal 2022, the fiscal 2023 estimate is still 35,000 hours below the pre-pandemic level. Exhibit 9 illustrates this trend over the past several years. The Volunteer Maryland program should comment on the change in the value of volunteer hours and in-kind contributions, which has been present since fiscal 2019 before the COVID-19 pandemic. Additionally, the program should comment on any efforts being undertaken to increase the value of volunteer hours and in-kind contributions. We have the Maryland Core Program and the associated Maryland Core Program Fund were created by Chapter 654 of 2016. Additionally, Chapter 37 of 2022 established a mandate of $5 million in fiscal 2024 with increased amounts mandated in the fiscal years following. This program provides service opportunities to at least 100 participants. These opportunities address various social needs of communities across the state. And additionally, the program provides scholarships to those volunteers who complete the program, which can be applied to vocational certificates as well as associate's and bachelor's degrees. The Maryland Core Program is a significant state initiative to promote service and volunteerism in the state. One of the governor's recent executive orders created a new Department of Service and Civic Innovation. The order specifies that GOSV, the Governor's Commission on Service and Volunteerism, and the Maryland Corps are assigned to this new department. Therefore, the administration should comment on the operational plans for the Maryland Corps program and how it fits in with the plans for DSCI. We have one narrative recommended in the operating budget recommended actions, which is that the committees remain concerned by continued low MBE attainment in state procurement, and that small business reserve and MBE program liaison positions remain vacant in some state agencies. This narrative suggests requesting a report on the participation and liaison surveys and to report the results. With that, that concludes my presentation, and I'm happy to take any questions.
Thank you, Mr. Polikoff. Seeing no questions from members of the committee, I'm going to call up Ms. Shamika Littles. Ms. Director Lewis, Director Johnson, I do know that Director Johnson, and Executive Director Conway.
Mr. Chair, may I call up Ms. Pamela Gregory, the Chief of Staff for the Governor's Office of Minority Women Business Affairs?
Perfect, please.
Thank you.
Yes, ma'am.
Thank you. Good afternoon, Mr. Chairman and members of the subcommittee. My name is Shamika Little. I am the Chief of Finance and Operations for the Governor's Coordinating Office's Shared Services Unit. Written testimony has been provided to you today on behalf of the boards, commissions, and offices. We thank you for the opportunity to appear before the subcommittee each year as you review the proposed budget. The boards, commissions, and offices are comprised of various budgetary units as outlined in the analysis, and those representatives are here with us today. And Mr. Chair, may I have your permission to introduce them? Thank you. We have the Governor's Office of Community Initiatives, Ms. Nicolette Young, Director of Budget and Finance. The Governor's Office of Small Minority Women Business Affairs, Pamela Gregory, the Chief of Staff. The Maryland State Ethics Commission, Jennifer Algier, Executive Director. The Maryland State Commission on Criminal Sentencing Policy, David Soule, Executive Director. The Governor's Grants Office, Jennifer Colton, Director. The Maryland State Board of Contract Appeals, Bethany Brinkley, Chairwoman. Other units include Healthcare Alternative Dispute Resolution Office, the Maryland State Labor Relations Board, the Governor's Coordinating Office's Shared Services Unit, in the Maryland Corps program. We would like to thank our analyst, Mr. Jacob Polico, for his work, acknowledgements, and patience with us. It's been a pleasure to work with you. The boards, commissions, and offices have instituted various cost measures in order to put forth another responsible spending plan for fiscal year 2024. Mr. Chair, I'm joined here at the table with my colleague, Dr. Samilia Okpadu-Puza, who will respond to the analyst's request for comment on page 2 of the analysis.
Good afternoon, Mr. Chair and members of the subcommittee. Thank you for the opportunity to speak today. My name is Dr. Samilia Okpadu-Puza, and I'm the Director of the Office of Service and Volunteerism. You have my written testimony before you. At this point, I'd like to highlight key findings as it relates to the comments from the analyst. The Governor's Office on Service and Volunteerism, also known as GOSV, underwent a routine Office of Inspector General audit that began in early calendar year 2018 and culminated in 2022. The scope covered the period of 2016 through 2019 for the office's administrative grants and not its pass-through AmeriCorps programs. The U.S. Attorney's findings pertain to the processes surrounding grant allocated timesheet reporting and in-kind contribution documentation. There have been many internal changes that have been made, which include multiple layers of approval for staff and supervisor timesheets, in addition to a multi-step reconciliation process of timesheet and salary expenditures. Policies and procedures regarding in-kind contribution have been updated, whereas GOSV will digitally store all in-kind contribution documentations to ensure accessibility. To alleviate the issues created by the settlement, GOSV hired and onboarded a director who was not in that role during the period of 2016 through 2019. And as required by the compliance agreement, GOCI hired a dedicated director of budget and finance that works with the GOSV fiscal staff. GOSV has revised existing policies around timekeeping, in-kind documentation, and training, and has implemented a required training plan for all GOSV staff. All of these items are included in the 3-year compliance agreement that is noted in the analysis. These are my official comments, and I am available for questions.
Madam CFO, that's everything?
No, sir.
Okay. So thank you for your time. My colleague Pamela Gregory, Chief of Staff for the Governor's Office on Small, Minority, and Women Business Affairs, will respond to the next key observations.
Good afternoon, Mr. Chairman and members of the subcommittee. Thank you for the opportunity to speak today. Written testimony has been provided. Under key observations on page 11, minority business enterprise participation remains stagnant. GOSVA concurs with your recommendation that we continue to collect and report the findings of the MBE attainment and MBE liaison surveys. Since beginning the task in 2021, our role was specifically to collect and report the data. No analysis was performed. In particular, the financial data submitted was not scrubbed for accuracy, a process we conduct prior to reporting MBE performance data in the legislatively mandated annual report, which is issued later. In response to your request, we will include our comments on how to utilize the data to improve MBE participation and discuss any methods that could be utilized to increase MBE participants and the impact of MBE liaisons with our response by December 1st, 2023. In conclusion, GOSBA concurs with the operating budget recommendation actions on page 15. Before I take your questions, I would like to introduce our new Legislative and Policy Director, Davon Gardner, who is with me today. Some of you may already know him from the halls of the Assembly, and so we're very excited to have him on board. I'm prepared to answer any questions you have at this time.
No questions, and you can keep going if you want.
With no further questions, I will turn it over to my colleague, Sharon Lewis, Director of Volunteer Maryland.
Thank you. Good afternoon, Mr. Chair and members of the subcommittee. You have my written testimony, but I did want to provide a few highlights in response to the analyst comments. Volunteer Maryland is an AmeriCorps program whose members serve a year of national service as volunteer coordinators in community organizations in Maryland. These AmeriCorps members report the number of hours served by volunteers at our partner sites to Volunteer Maryland. The data that they report is what Volunteer Maryland reports to the state through the MFR. The hours and the in-kind value of volunteer contributions are linked. We calculate the in-kind contribution amount based on the current value of a volunteer hour as reported annually by two independent organizations, the Independent Sector and the University of Maryland School of Public Policy's Do-Good Institute. This annual report serves as an industry standard for charitable organizations to quantify the value of volunteers. Nationwide, as reported by AmeriCorps, there's been a 7 percentage point decrease in volunteering since 2019, even as the pandemic has become less acute. And a new report that was released just this month also by the Do-Good Institute and the Initiative for Strategic Volunteer Engagement reported that the majority of nonprofits say that the COVID pandemic has continued to disrupt their volunteer programs significantly 2 years after its onset, with nearly 70% reporting that they were still using fewer volunteers than normal in 2022. The other factors impacting the reported decline are the AmeriCorps member and recruitment challenges that Volunteer Maryland, like other AmeriCorps programs in Maryland and across the country, are experiencing at this time. We are competing with a strong job market and rising inflation. The modest AmeriCorps living allowance of $16,500 for a year of full-time service hours is a barrier for many individuals to commit to or complete a year of service. In an effort to address and increase volunteer hours and in-kind contributions, we are seeking to increase the size of our AmeriCorps member cohort, the number of our partner sites, and work with and engage more stakeholders and community organizations during our recruitment process. Thank you, Mr. Chair and members of the subcommittee for inviting me to speak today. And I'm happy to answer any questions that you have.
Thank you. Seeing no questions from the committee, could you just, in reference to the 7% in the drop, could you just explain the correlation?
The correlation between the 7% drop. I'm just really wanted to speak to sort of a nationwide reporting in a decrease in volunteering that may be impacting and correlated to the decrease that you're seeing in the report.
All right, thank you.
Thank you for your time, and I will pass to my colleague Shamika Littles, who will respond to the next set of key observations.
Thank you again, Mr. Chair. On page 14, the analyst asked for a comment on the Maryland Corps program. The fiscal 2024 budget that's before you today has the Maryland Corps program located in the board's, commissions, and offices budget. As you're aware and mentioned in the analysis, the governor introduced the executive order outlining the creation of the Department of Service and Civic Innovation, which includes now the Maryland Corps program. Just to note, there will be a hearing held in the Senate on February 28th for that office and on March 6th in the House. And at that time, the administration can provide additional details on the program. Thank you for your time. We'll wrap up and conclude our testimony for the D15 portion of the analysis for boards, commissions, and offices. And now I'll pass it to my colleague, Ms. Chanel Johnson, the Executive Director of the Maryland Commission on African American History and Culture, to respond to the key observations.
Thank you, Ms. Littles. Greetings, Honorable Chair McCray and members of the subcommittee. Thank you for having me here today. I'd also like to thank Jacob Polico for his hard work and acknowledgements of our efforts throughout this analysis. He is a pleasure to work with. The Maryland Commission on African American History and Culture currently operates the Banneker Douglas Museum, Maryland's official state museum on African American history and culture, and the African American Heritage Preservation Grant in partnership with Maryland Historical Trust. In FY 2022, the commission was legislated as an independent state agency. Since that time, the commission has worked diligently with the Governor's Office of Finance during this time of transition. The commission plans to onboard a chief financial officer and program staff by the spring and summer of FY 2023, this fiscal year. The chief financial officer will manage the commission's fiscal activities, audits, and procedures. The new program staff will improve the quality and reach of the Banneker Douglas Museum's core services, such as our traveling and on-site exhibitions, youth programs, and marketing and outreach. These positions are critical to the success of the commission and its operation of the Banneker Douglas Museum and its ongoing service to the public. Thank you.
Senator Hadelman, did you have a question? Okay. Director Compton, one of the things that I noticed from the last year report, it said that you all had a goal of 60,000 and you like blew that goal out of the water with 160,000 visits. Is it anything that you want to comment or say about that? Because it's obviously a good opportunity. It's a great position, but like.
Yes, I would definitely have to credit that to our online programming. With our new marketing director of communications, we made a really successful pivot to online programs and a greater social media presence and promotions. And we're excited to grow that to even higher numbers with our increased program staff in regards to our on-site and online visitation.
Thank you. And seeing no questions from the committee. First, Mr. Polikoff, I just want to say thank you always for your comprehensive analysis. And Madam CFO, executive directors, team, just want to say thank you all for your leadership and thank you for answering the questions. You all have a blessed day. Colleagues, this ends the hearings for HHS. Look forward to seeing you all tomorrow, right after session.